neighbours or friends to visit more frequently or more often?
As in visiting nursing homes, etc.
Yes, yeah.
We do everything we can. It's our job. It's our role within the Care Act that we are supporting carers. So if an individual has got a loved one who's in a care home, then we're required to do a carers assessment. And part of that is really ensuring that we have that social contact, and then we can support to maintain that social contact. That's part of our requirement. So yes, I think is the answer to that. We are required to cover that.
To add to that as well, we have within adult social care, we have a practice model which basically supports our workers around the theories and approaches they should use in their practice. And we very much use a strengths-based model, which is all about working with people and those around them to really strengthen their network, whether that be family, friends, or local community. So I think that goes quite a long way towards that as well.
And to add to that, we've really recently invested in the Carers Partnership. So that is a partnership between Age UK, Pink, which are Positive Inclusion, so they're the Learning Disability Service, and the Young Carers Association, and the three agencies work together to provide a service for our carers in Wokingham. It provides an alternative to statutory services. Sometimes we find that individuals get more from speaking to the voluntary services. They feel that it's more independent. So we've invested and commissioned, a service there, which is really there to reach out to our carers, to connect them, provide those support services, and be eyes and ears in terms of any gaps in services as well.
Rochelle, please.
Are any of our providers having problems with finance because of the increase in national insurance contributions? And also, the fact is that they can't really bill the poor people who are in the home more money, that much, and Wokingham doesn't have a whole lot of money to subsidize them. It's just the fact that we're having less money coming in, and the government is not giving us more money. I don't know what they're doing with the money, but that's another story. That has nothing to do with you.
You're right. Do you want to go? Or do we?
I mean, I think it's definitely very fair to say that we anticipate providers facing increasing difficulties around those exact issues. The changes in national insurance, etc., will inevitably have an impact. What that impact looks like, suspect will become more apparent over the next 2 or 3 months. We certainly don't have any providers that right now are in a provider failure position, but that's not to say it won't end up there. We do have a robust provider failure framework, which sits under Wesley Hedger, who is the Service Director for Commissioning. And we obviously work really closely and proactively around providers in that respect. In terms of more granular detail, if anything's required, we can reach out to Wesley and get that and feed it back to you. I don't know if Lisa wanted to add to that though.
Just that, we do anticipate there are going to be issues in this area. We've been having conversations today about uplifts, which are due for April. And we are looking at what level, and we're hoping that for Wokingham, it is going to be better than some other areas can offer. But we're worried that isn't going to be enough with the new things that have come into play, and it's going to cause additional pressures. So I think we're trying to reach out now. We're trying to reach out as early as we can to support those providers, and like Lorna said, to sort of prevent provider failures, because it's going to be an issue. I don't think we can put our head in the sand about that. If you do want any more information, we're very happy to get more.
Yes, could we have it more? Could we have some more information? But what is going to happen if one of the providers fail because they can't afford to keep in business? and we don't have enough spaces in other places to put our individuals. Well, they're all going to be there sooner or later. I mean, most likely, either that or we're going to be dead. As we get older.
That's a jolly thought.
Well, it's the fact.
Yeah,
it's not.
true though. Yeah. I think all we can say at this point is that we've got a really robust market provider failure. With that, it starts by, if somebody approaches us, it starts by us looking at how we can support them. What can we do as a council? What can we afford? What can we put in to help them? What other measures are available to us? What's within our gift? The reality, and we've had this with providers over the years, where they've just gone in much higher than we can afford, and we know that we've got a slice, we've got a cake, and that has to be split between how many providers, so we can only give so much, and the reality will be that we will have to do our best around that. And if someone goes bust and we've done all we can, we're then looking at what alternatives are available for the individuals, and that's not a good position for anybody to be in.
It's been relatively rare in Wokingham over recent years for that to happen. But as you said at the beginning, the landscape's looking more challenging. It might be worth us actually sharing the provider failure protocol with you, because that sort of explains the various strategies that we would use. So we can arrange that.
I think we know, we realise there'll be some commercial confidential information. We're not really searching for that. We're looking, I think that would be a very good idea to present the protocol at the next meeting that you present to us. Ladies, unless there's any other questions from any other members, you're free to go, but I would say before you go, I did go to the Royal Berks public meeting this morning, and it may have some information for you which may be useful. So you may wish to listen in, or you may wish to doze off, depending how I'm talking.
We'll stay on, Adrian, thank you.
So before you disappear, I thought I'd give you an update from this morning's meetings. So the hospital, Steve McManus, the CEO and the chair, Graham, are very, very disappointed with the plan to deliver the new hospital 2037, 2039. They make the point that that's 4 parliaments or 3 elections away, and there will undoubtedly be massive change in the MPs over 3 elections and 4 parliaments. So it's a very long time. One thing that they were talking about as well, obviously the current site is, some of it's over 220 years old, I believe, and the other stuff at the other end is full of asbestos. So the 45 properties actually require really major and significant investment. And they're talking about an additional capital budget of 400 million over the next 10 years to just keep RBH going. So, if you add maybe 5% inflation over 10 years or something like that, you can easily get over 500 million, 600 million, 700 million. And the new hospital is going to be 1 point something. So, and that, you'd be investing 400, 500, 600, 700 million into something that would be bulldozed and turned into residential. So, but the argument has been lost with the Treasury, I believe. So it's pushed out to those dates. Beth.
Could I just add to that, Chairman, that I was at PMQs today in the House of Commons, and Clive Jones MP, the MP for Wokingham, asked to meet with West Streeting and others, and was promised a meeting to talk about RBH. How that promise will be fulfilled is yet to be decided, but it is being pushed in the Houses of Parliament.
Thank you very much, Beth. Thanks a lot for that update. And just to give you an insight on the kind of additional costs that they have, I think in 22-23, the additional capex for maintenance and upgrades that year was 46 million in 1 year alone. But they did introduce a topic which I found very interesting. I'm always wittering on about IT integration, especially with primary care networks and the hospitals and their systems. So they introduced a guy from a software supplier, and they've been working about 12 months on a thing called e-triage. It's not from Yorkshire, it's from Reading. It's, and it is a referrals app. So this is an app on your phone, so the doctors can, using an app on a phone or, you know, in a web browser, whatever, they can do referrals for patients instead of pieces of paper. Now, there will be a significant cost saving in terms of process automation, because at the moment it's a paper-based thing with data in different systems within the hospital which doesn't talk to each other. But the app has a back-end system which is a middleware which interfaces into these different systems that are in the hospital. Now, the interesting bit around that is this sounds very, very positive. So it should streamline the referrals process. But this is, I would say, in sort of phase 1 implementation. I would call it phase 1, they didn't. Phase 1 implementation at RBH. But they've sold it to Books. So Books are going to implement it as well, and they're in a sales cycle with Oxfordshire. So they're hoping that the same application will be used across Bob, because there's no process automation application for referrals at the moment. As I said, everything's paper-based across Books, Oxfordshire and Berkshire. So this was extremely promising from my perspective, and the future sort of ideas they've got for deployment really would enhance the integration, you know, into deeper and deeper into the primary care networks and between hospitals. And one of the next phases they talked about was opening it up so that one doctor could refer a patient internally within the hospital, as well as this is at the moment just referrals from outside, I believe. So the whole process is absolutely suitable for IT and automation, and that is progressing in a very good way. So that was very positive. That's my update. Question?
The Royal Berks is built on chalk mines, and the top floors of most of the buildings are unusable, and they're going down. It's more and more, next level down is going, the next level down is going. And waiting till 2037, maybe there may only be one floor left at that point, or maybe two if we're lucky, maybe three. But, you know, where are we going to put all the patients? It's ridiculous. There's rack concrete in there too, I also understand. And it needs to be done now, not in 2037, because of everything else. Because other than that, we're going to have to put up tents and put people in them.
Yeah, I mean, that's a question for outside, really.
Okay, I just wanted to know
what
RBH will be doing for it. Can we ask them what they're doing?
You know, I think, you know, RBH and Building Berkshire together have done an awful lot of work, and the objective of that work was to get an appropriate site. And their conclusions that they came to was that they had to move site for some of the reasons you've mentioned. So, I can't disagree with any of the statements you've made, but, I can't really respond on behalf of Building Berkshire Together because I don't represent them. But, the plan is obviously to move site. Alice, sorry, did you want to ask a question at this point?
So I want to, can you hear me? Yeah?
Yeah.
I want to just acknowledge the work that the RBH has done about this moving sites and everything. And I really feel sad that the team that has done a lot of work have been asked to stand down. The materials that they have, it's not going to be usable in 2037.
I mean, every meeting that I've been to, we've tried to support the hospital from the governor's side, because I'm a governor there, and they've done their due diligence and they've gone way beyond their due diligence. And they've done a really good job and got to very sensible conclusions. And all I can do is reiterate what was said in the meeting this morning, which is they're very, very disappointed with the response they've got in terms of dates. But as Beth said, Clive is going to challenge West Streeting. I mean, the numbers don't stack up from my perspective because it costs a fortune to keep RBH ticking over in maintenance. And it's money down the drain. It is completely down the drain. Anyway, moving on topics. Ladies, you're free to go now. You can go and have your tea or something and go and have a cup of Coke.
Thank you. Thanks for having us.
Thank you very much for presenting today.
To
And I think Alice is next, isn't she? Alice, as if by magic, you're next. So we would appreciate you to give us a quick update, please. Thank you.
So, thank you, Chair and Councillors. I have shared with you a paper with all our activities to date, and I hope you've had a read and have any questions to ask. I mean, I just wanted to update regarding the first item, which is a GP access. Though this paper was done, the project that was done in 2023, but the themes that is coming out of this report is still taking place today. People are still struggling with GP access, especially getting appointments. So what we are going to be doing is taking this project forward to the new financial year, so that the GP access as a project is not going to go away. But we are also working with the ICB and the primary care to try and close the gap, like communications to the public, because we have to accept that nothing is going to be changing. The systems are already here. We need to get the public to navigate the system better. So a lot more communication is going to be coming up soon. And I would appreciate if there's support from the committee as well to share this kind of information as well, because I do think that is the way forward. And also, our report has also been acknowledged by the digital team at the Integrated Care Board to try and work together to see how the NHS app can be doing better, because there's too many apps out there. So there is a lot of work there to make sure that it's only one app for the public. So that's also been taking place. We've also been working about, you talked about system coding. We've been working on that also as well. We're trying to get the systems, from RBH to the GPs in order to flag up vulnerability. For example, if we've been told that learning disability is in the system and it could be easily flagged up, but actually in practice, it doesn't flag up that easily. So we're working with the health inequalities team at the ICB to try and make this a little bit better. As normal, dentistry is another one that's still the same theme. People are still struggling with dentists. and especially in Wokingham, the learning disability cohorts from our report showed that there's no issues, but I think a lot of that is again a coding system, because there is no coding system in the dental surgeries either, nor in opticians, nor in pharmacy. So coding is something that we are trying to work with the integrated care board to make it better. And we still have Wokingham Medical Center as on our radar now still. The work we are doing at the moment is escalating to the Care Quality Commission with all the feedback that we get, so that they can see what we are getting. Then the other thing that we're also working at is also about Women's Health Hub. As you maybe alluded to, that we are doing a project with a Brookside Surgery to looking at women who need pessaries and menopause support. That's money that was brought down from the ICB Integrated Care Board to look at Women's Health Hub. This is only a 6-month project, which will end in March 2025. However, lately we've just found out after this project, there will be no more funding. So we are at the moment looking at trying to see how we are holding their Integrated Care Board to account, to asking them what has happened to the money, why are we not, why Berkshire West women are not being provided with women health support. I'm also talking to public health to try and see whether they can also help. But I do think that this is an issue that needs to be raised, because the women in Berkshire West are being deprived compared to Oxfordshire and Buckinghamshire. The other project that we are part of is also the South Asian Women, which we had over 100 women from South Asian women who have shared with us the issues about access to services, especially GP services. And that report will be coming out soon at the end of February. And I think there's a lot of learning from there, because what they have shared is no different to what other women share. Example, like making sure that we have flexible access to GP services or any services, because they are also carers. And I think no woman to say that that is not a problem. That is an issue, but especially if you're working, or especially if you're a carer. The other thing that they've also asked is for a female practitioner to help them, but also more information about screening that they need. But they also asking that it could be in the language that they are comfortable with. And then we also have the youth voice, which I have shared. And one of the things that have been highlighted is about education. So I do think that and we looked at women again, and the young ladies have shared with us that in schools it's quite uncomfortable to speak about sexual health, and they also encouraged that a different terminology to be used in schools, like example, like me and my body, rather than talking about sexual health. So that's something that we will be championing when the report comes out. But also lack of awareness of sexual health services is also something that is coming up as a theme. We also have done a joint event with Healthwatch Reading, because I'm also the lead officer with Healthwatch Reading, and we did an event to look at interpreter services. And one of the things that, again, coding was a theme that has come up, and we are now working with all the councils to make sure that they have a good system, a coding system. The same with the hospitals, In fact, just to share with you, at Royal Berkshire Hospital, now they are trialing out a system, an interpreting system called Word Stick on Wheels, whereby it's an interpreter system. It's like a computer that comes near to your bedside, and you can talk to the interpreter like the way you're talking to me. So it's a virtual communication, which is much, much better than getting someone all the way from Slough to come down to Reading. So those are things that's been happening. And then we are continuing with our engagement. We are going north, south, east, west of Wokingham as well, trying to get feedback from the public, and also doing virtual events. And then our final one is we had an end of year celebration, which Councillor Rowlands came to, as well as you, Councillor, as well as you, Chair, and you had our key speaker speak, Jonas, who was first time, not long into his post, and he came and shared his vision of what partnership looks like. And just also to say, do have it in your diary. Our next event is our launch of our annual report, which is July the 16th. And we are fortunate to have our keynote speaker being our CEO of HealthWatch England coming. Thank you. If there's any questions.
Yeah, we do have some questions. Rebecca first.
You touched on it, Alice, but I did read yesterday that the women's health hubs are not moving forward in the forward plan. They've been scrapped. Wes Streeting announced that he's dropped them yesterday, which is when it had been promised, so it's incredibly disappointing. So does that mean that the only women's health hub that we have in the borough is this one GP surgery? You don't know if you're going to be getting funding forward, and there's going to be none others. Is that correct?
Yeah. Even the GP surgery will not have that facility either. After March.
But within Berkshire, so in other areas in Oxfordshire, they do have it, yet we don't.
Yeah, nope. And I think, and then that's the one thing that's definitely not. Yeah, you're right. Oxford and Bucks have got it, but Berkshire West. In fact, to be honest, when we found out that and it was HealthWatch who highlighted it, we found out there was money coming from the ICB, and we were told there was a certain amount of money, and then that money got sort of disappeared. So we wrote a letter to the ICB asking them, holding them to account and asking where's the money. As soon as our letter landed and it was open kind of thing, next thing we saw the money come down to Berkshire West. However, the amount that was shared was not the amount that was promised.
I was talking about this with Jonas actually the other day, about the inequality that there seems within Bob, and especially to us within Berkshire, and about the way the services are being shared out, in my humble opinion. And this is disappointing, because it can save a lot of money. It's health promotion, and that's what this is all about. This is catching things before it gets to the point, where people need to go into hospitals. So it's disappointing that this is being dropped and there's no further funding. Because, if we want to reduce waiting lists, which is what we want to do, we want to stop it getting to the waiting list beforehand. So I wondered how it would affect us locally when I heard it, I read about it yesterday.
Well, I think in a lot of ways, we are not keeping it quiet. We are going to be doing something about it. We have written to the Integrated Care Board. We are writing to the Integrated Care Board to asking them to hold them to account and to turn around and tell us what is going on. So we are just waiting for that to be happening soon. So we are not going to be quiet, to be honest. But
Jonas, do you want to add something in there, Jonas?
No, I was just going to add. Alice sort of emailed me about this today. Again, this is sort of fresh news for me as well. And I picked this up actually with Matt Pearce, my counterpart in West Berkshire and Reading. So I think there'll need to be a bit of unpicking around this, and certainly keep, obviously Alice is in the loop essentially as well. So we'll compare notes, Alice, about where this is going.
Keep us in the picture.
We would definitely like to be included in that knowledge base. But I would say that Rebecca and myself do attend the joint Bob Hosk meetings, and it would be great if Rebecca or myself had some information that we could ask some questions at the joint Bob Hosk meeting, because when I went to the last one, Nick Broughton, the chief exec, was saying that services were different across different regions, Bucks, Oxfordshire and West Berkshire, and that they wanted to bring the poor ones up to the higher level of the ones that are in a good position. And this seems to be completely contrary to what his main message was at the last Bob Hosk meeting. So if either of you have any evidence, please send that to Beth Rowland, the chair of Hosk, and Rebecca and myself, please. And we will try and ask questions of Nick when we next meet him.
Thank you, Chair.
Thanks, Chair. And it'd be useful for me just to have the dates of those Hosk essentially, so that we can make sure that we feed in information to you as necessary, and so you're well prepared.
Yeah, when is the next one? We don't know. Yeah, there was a lot of shenanigans at the last one, unfortunately. But as soon as we know, we'll let you know. Thank you very much. There was Rochelle, I think, next.
You mentioned the ICB board, and my question is, what is the ICB going to be doing about all these new estates we're building, and the fact that the government is already doubling our housing quota, so we need to have doctors for these people? And how are you going to find the GPs, first of all? Are you going to be able to get European GPs here? Because they should be able to work here as a possibility. But what can we do to make sure that we have doctor surgeries for all the new estates? Because it's not part of the planning process to say whether we have doctor surgeries, but the people sure as heck want them. And what can you do to help us do that, since you were talking about the ICB, and get the ICB to train some more GPs, but they don't seem to be doing that very easily. A friend's daughter who had A stars couldn't get in to become a GP, couldn't get into the thing. This is ridiculous. We need more GPs, and we need more GP surgeries. It doesn't matter. I'm not just talking about Wokingham Borough. I'm talking about the whole of Southern England needs them, because if we're building double the number of houses, you got to go somewhere. And it's bad enough right now, several weeks before you can see a GP. It's going to be a month or more, and that's going to be a real problem.
I mean, I do ask these questions at Bob Hosk. And
I'm asking Health Watch, can she help us get...
Michelle.
Yes, sorry. I'm hoping that you can help us get some more surgeries in Berkshire, or not just having the two of them asking in Berkshire, but having you push for more surgeries in all of the counties, or whatever new things that we're going to be merged into.
I mean, when I was at the last Bob Hosk meeting, Oxfordshire definitely has there's going to be huge numbers of houses built there, and they're in the same boat that we are, like Arborfield and Finchampstead and everywhere else. So this is across Bob that it's a big issue. One of the things I fed back to Madeline was, for me, one of the most critical things is GP capacity. So that's why I put on that a data requirement for Bob ICB to present back to us what capacity each GP surgery is supposed to be, what it's actually at, and if there's a deficit, what are they going to do about it? I did hear a story, it was online, about a significant expansion in West Berkshire of a GP surgery in Newbury, I believe. I'm not sure whether it was on the Bob ICB News or something, but clearly our area and everywhere else in Bob needs significant investment, both in buildings and people. And we keep asking those questions. But, you know, Health Watch and Jonas, amongst your peers, you know, I guess the same is also true.
It's a hard, I mean, I've learned this in the short time I've been, it's a hard conversation. I know that the MP is particularly interested in this. I know yourselves are interested in it. I'm interested in it. The rest of the CLT are interested in it. So again, I suppose those questions are things that we ask on quite regularly, and I think come up in HOSC as well. So it is a difficult one, and perhaps maybe we need to discuss about how we sort of tackle this one, because it is tricky.
At the same time, you know, RBH's strategy, bearing in mind it's not going to have nice new buildings, RBH's strategy is going to push patients back into the primary care network at the same time, right? So we're, you know, when I talked to one of the surgeries in this area, they said they are already significantly over their maximum capacity, and their buildings are totally inadequate, and the number of GPs is inadequate. The number of associated health professionals, nurses, whatever, paramedics is totally insufficient, and nobody seems to take any notice of what they say. They keep saying that to the ICB, they keep saying it to everybody who listen. So, you know, I think if we get transparency, if we get reporting on GP level, GP surgery level capacity and overcapacity and undercapacity, then we can refer back to the local plan, which should be coming out in Q4 this year, which is going to say, you know, we've got, you know, 780 or 1,330 houses a year to build in this little part of the world, and we have no capacity for any people to go and see a GP, which is basically the case now. It's, you know, I keep asking Bob ICB, sorry, I've been asking the CCG for 6 years, you know, what are their capacity plans for Wokingham? And nobody's answered that question in 6 years. And there was, in that document that Madeline shared on Bob KPIs, Wokingham was missing in one of the key slides around capacity. So, you know, we need to get transparency, because I think we all have the feeling that we get not a poor deal, you know, both in terms of dollar per patient, but GP per patient, nurse per patient, everything else. That's what we feel. But until we get transparency on the actual numbers, which Bob should be able to provide, Bob must have this data, because it has lots of data about the PCN, and it has people responsible for the PCN, must be able to answer our basic questions about capacity in the network. And when we get those answers, that should give us some ammunition to say, hey guys, how come Oxfordshire or Bucks or wherever is getting a lot more than we're getting, which we think is the situation. But until we've got the real prima facie evidence, we can't go back until we've got that evidence. But I've been asking these questions for 6 years, sorry. And I'm a bit tired of asking the same old questions. Jonas, do you want to say anything more?
Just briefly, I know Madeline, the ICB primary care team are coming along to next HOSC, I think that's right. So it'd be worth briefing on these questions again. In terms of other things to be aware of, I suppose we've got the NHS 10-year plan coming up, I suppose, and again, ICBs will be interesting to understand how ICBs sort of meet those shifts in terms of prioritising prevention over treatment and from hospital into community. And just to also say that I have been to the connecting in with the RBH around their modelling. I know this is now paused, so I need to go and connect in with that team, but I still think there's some learning that we can do about actually what does the community offer look like? Does that mean that outpatients might be in the community? ? So I'm actually sort of meeting with other new hospital programs around the country. So I'm speaking to about 3 different areas to understand how their hospital models work and what their community offer is. So hopefully that learning will be useful, and I'm doing that with Matt Pearce, who's the DPH at Reading, West Berkshire.
That sounds like really useful work. Thank you for that. Did you want to add something, David?
Do you mind if I have a word?
No, no, you're fine, David.
Thank you. Sorry, I disappeared for a while. My computer disconnected. 2 things. One, I expect we all know that GPs get the lowest settlement in the country per patient. And that's often why, if they had capacity to expand, they find it very difficult because they haven't got enough money to do what they want to do. But also, certainly I heard someone from Bob at a Bob meeting say that Woking was very well serviced with GPs. And I said, is it really? Can we have the figures? And the figures, as you said, have never come forward. And I think that's something which we need to press Bob on, because it is something which we in Woking all get complaints about, and certainly I know that things in the south of the country are very different from in the north. I well remember, this was 15, 20 years ago, but someone coming from Hull up in the north down here and saying it was like coming to a third world country, what he could get and the way people waited. So, there is a very vast difference between places of real need and poverty and places like us, which are meant to be healthy and wealthy, but people want to have the doctor before they're ill almost. So certainly we need to push for our residents, and I think that's important.
Thank you for that, David. Obviously, I speak Northern as well, Midland anyway. And, when I came down here, I grew up until I was 25, lived in Stafford. And in Stafford, there was a huge number of GP surgeries. And around here, we have Woking Medical Centre and Woos Hill, and we've built many estates now, and there's been no increase in the number of GP surgeries, which I think is a catastrophe. And I have asked that question at Bob, and all their eyes rolled around a lot, and they didn't give me a decent answer.
Can I say something? Is it possible for the HOSC to do a freedom of information request?
Well, effectively what I'm asking Madeline to ask Bob is the capacity information at surgery level. And if they refuse to give us it, then we will put in an FOI.
I think you've waited for 6 years.
Well, I've been asking the same damn questions for 6 years about GP access, number of GP surgeries, number of GPs, and also the CCG used to be extremely evasive about how many residents actually lived in Wokingham. And and I think they got their numbers completely wrong. And I think they were working on old numbers. So, I think the demographics and the number of residents has changed massively, and we can see that from the ONS census. We've got a 45% increase in the number of people over 60 or something, 43%, and when you're over 60, things start going wrong, things start falling off, or or start squeaking or aching or whatever. So if you've got a 43% increase in the number of people over 60, you've got a significant extra load onto your primary care network. David.
Thank you. Also, I know that it's true that Bob has not funded a new surgery for at least 10 years, and they have no money to do that, and they'll say so, and they want developers to fund, developers and local authorities and anyone else but them to fund new surgeries. And that is another of the great problems. And even expansions of surgeries, they haven't done that. And certainly, it can take an awful lot of money out of a business expanding. And until you expand, you can't take in new patients. But when you've expanded, you've got to take the patients in almost straight away because you've got the capacity. And so there's a thing that, well, it's dangerous to do that. And so, that can be very negative as well.
I mean, every time I go into Woking Medical Centre, I'm astonished at how the staff work there and that they don't go insane. The load on them is enormous. If you look at their pharmacy, I went in there at 9 o'clock on a Tuesday, and it's a very small room, and they've got 8 pharmacists, and they were dishing out tablets at an incredible rate with the automation that comes from upstairs. And, I can't believe how many scripts they do, but, it looks like, they need twice the size of building to cope with, whatever it is, 25,000 patients or whatever it is they have these days. But I'm moan over. Have we got any further questions for Alice? No further questions. Alice, please keep us updated. And if there's any way we can ask questions of Bob, we will. And if you can ask questions of Bob, please do so. So with regards to this Women's Health Hub, I mean, it just sounds ridiculous that they're pulling this from Wokingham and West Berkshire when it exists in Bucks and Oxford. That's terrible. We need to really highlight that that's a very retrograde step. And I will be jumping up and down at the next Bob Hosk meeting about that. I'm very unhappy about that.
Can I? Yeah.
Please go ahead.
Can I just say that the letter that's going to the Integrated Care Board, I will share it with the Health and Wellbeing Board and also the HOSC, because I do think you all need to know. And also, Jonas is the other person that it is going to be shared, because I don't think we can keep it quiet.
I mean, that would be really helpful. But also, if you do manage to get the Health Watch England, get an ear with them and say, hey, we're having services that were agreed, we're having budget pulled and services removed from just one area in Bob, while the other 2 areas are continuing with their ongoing services, which is clearly unfair.
Yep, we're on it. We're not keeping quiet. Since we've heard about it, I don't know how many emails I've put out. I think Jonas was one of the very few. But yeah, we will not stop. We'll do our best.
Alice, can I offer to help with that? Jonas and I can talk to Sanjay about it. I've written a few notes of questions for him as well to attack it from that area. And so, are you in tomorrow, Jonas? I was going to say I'll send you an email, but if I can see the computer, I'll send you an email. And we can see if we can take that forward.
Councillors Rowlands, just to share with you, it's not Sanjay that we need to talk to regarding the women's. If you're talking about the Women's Health Hub, it's not Sanjay Desai that you talk to. It's got to be higher than that.
Yeah.
And it's either you either go to the chief nurse, which is Rachel Kosa, who is also part of the women's. She deals with the women's health stuff. So it's not. Or the other option is you could speak to our new place director, and who's also the person that we should be directing all this information. So so if you want to talk about the surgeries one, I think yes, Sanjay would be the person, but I do think the women's health is a little bit higher than that.
Yeah, no, Alice, I'll do both. I'm happy to do both. I've had an eye operation, so I can't read my computer yet. So if there's a delay in replying, it's because I can't see. Okay.
I think Beth needs one of those at the RBH that comes up to your bedside and says, hello, would you like a cup of tea or something? I don't know.
That would be fine. Yeah,
It would be nice, wouldn't it?
Yeah.
As long as you can tell it, when you don't want to see it, as long as you can tell it to sod off. Right, Alice, thank you very much for the update.
Okay. Thank you.
Oh, sorry, Jonas again, you've got your hand up.
Sorry, no, I was just going to reply to Councillor Rowland. We can pick that up tomorrow, Councillor, and work out who to best speak to around this.
Jonas, if I don't answer your email, can you give me a call?
Will do, will do.
Thank you.
So you can see your phone.
And now I can hear my phone.
Ah, good, glad to hear it. Jonas, thank you very much. Alice, super, thank you very much for your support. Really appreciate it. Thank you, David, as well. I think that is the main business over with. We've just got the forward programme to look at, so we can release you. Thank you very much.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Do you want to take this?
Sorry. So we've got quite a busy meeting next time. You'll see that we have on the agenda an update from RBH. Obviously, given developments, that may change, but I will keep everyone in the loop as to that. And we do have updates on pharmacy and dentistry from the ICB and the KPIs. So that's quite a full agenda, and that will be our last meeting for the year. Just to remind everyone that the management committee at their meeting in March will be looking at work programmes. So if we could start giving some thoughts about items that we want to consider next year as well, that would be helpful for feeding them.
I mean, in terms of work programmes, I think, this meeting, because I've been on this committee for 6 years, this committee meeting was definitely enhanced when Ingrid Slade supported this meeting, and Jonas is continuing with that. Thank you very much, Jonas, for your support. Really appreciate that. But I don't know if there's any sort of quarterly briefing that we could do with from your side, Jonas, whether you think that's relevant or appropriate. But, we want to make sure that we keep abreast of whatever the key topics that you're working on are. So, if you could give us a briefing maybe once a quarter or once every half year or something, I would like to include something like that in the programme, so that, I think we've got to a stable position. We're getting regular adult social care KPIs, and we're discussing those. We're getting regular Bob ICB briefings. I think public health is an area where we need regular briefings, whether they be once a quarter or once every half year, whatever suits you. And I think that rounds it out a bit better. Please go ahead.
Chairman, you'll be aware from the OSM meeting when we look at the KPIs that we have a whole section of KPIs that are about public health. And why are we not looking at those within this meeting?
I couldn't agree more, Alison. So, you know, I think as that's a health matter and we're the Health Overview Scrutiny Committee, they should absolutely be coming to this committee. So anything health should be on this forward programme, and that includes public health as far as I'm concerned. Completely agree. Sorry, Alison again.
So Madeleine mentioned we've only got one more meeting in March, and obviously we don't normally have meetings in April because there's elections. There aren't any elections. So we're going to have a meeting in March, and then we won't meet till probably June. Now, in October, you'll see on page 41, it mentions that it was suggested an extraordinary meeting be held in February to look at domiciliary care, including the market position statement and the adult social care workforce strategy, which I think Nagi's interested in, because you said about maybe having a KPI to understand more about the essential workers we have. Is this something we could look at within this council year? I mean, obviously we're not going to fit it in the March agenda, but I just wondered what would happen to that item.
So I haven't been able to arrange it for February because of pressures within the team. But we could look for a later extraordinary meeting if you did want to have it in April. We could look for that.
I think we're all agreeing with you, Alison, that let's not have one mega meeting with a huge agenda. Let's have an additional meeting in April and shift one or two topics into that. Is that okay, Madeleine?
So that we don't have such a long break.
Yeah, very good suggestion, Councillor. Welcome back, Jackie, as well. Good to see you. Nagi's being super patient with me, and he's got his little hand up. Off you go, Nagi.
So in last month's, November's meeting, we have presentation on winter pressures preparedness. Okay. And I have visited a couple of times to the A&E in the month of December and once in January for various reasons for family and friends. And I haven't seen anything positive in those visits. But when they presented the preparedness plan, it looked good. So basically I'm keen to know, I think things went wrong, but I'm keen to know what they thought about it and what are they considering it, because as it is quite early, because they're just coming out of it. So I think it will be quite good to get their views on it.
Okay, so forgive me if I misunderstand you. Do you want a follow-up on how the winter preparedness plan went?
Yeah.
So if we're hoping to have a meeting in April, would April be an appropriate time? Would that suit you, Nagi? Would that be too late?
That's fine, yeah. It is a little bit too late, but again, yeah. I have two more things. But usually...
If I can add to that, I think it's a very good suggestion by Nagi. I think, having a good plan is lovely, but what's the execution and delivery like? And that's your question. And that's a very good question. And I think we should be interested in that. So what I would say is this was mentioned at the public board meeting this morning at RBH. However, they didn't have the December numbers yet. So again, back to Madeleine's point, it's a bit early yet for the full data set. So when they get the full data set, whenever that is, probably March or April time, by the time they've collated everything, we should be asking those questions. I think it's pertinent. Thank you for that suggestion. Any further? Not another suggestion.
Sorry, I have only two more. Yeah.
Only two?
Yeah. So the other one is from today's public board meeting at RBH, there are a couple of lines on RTT waiting list. Okay, so they mentioned about the 52-week RTT waiting list. Okay, if you are not green on 52 RTT waiting list, that means there is fundamentally something very wrong. Okay, and that board meeting minutes say it is good, but yeah, I'm not interested in the 52 weeks. We are interested in 18 weeks and anything. Yeah, so probably if we can have some KPIs on the waiting list, that would be great. I know nationally it is a big fuss, but again, locally, I think we should work with the hospital and the ICB to, yeah, keep a track on it or discuss more about it.
So in the pack that I saw today, there was a lot of KPIs, and to be frank, there wasn't the time to go through all the KPIs because there was a lot of other things going on, you know, with regards to the big ticket item like, is there going to be a new hospital or not? But again, I think that's a very good question. And you said you've got another one to come?
Indeed, yeah. Again, this is around the A&E. The A&E target is usually 4 hours throughout the year. Yeah, so if we can keep an eye on the A&E one, that would be good as well.
I mean, again, that fits in very neatly with the winter pressures and the mitigation plans that they've had around the outpatients in the hospital, which they were talking about today, but they need to state all this. And was it Alison again?
Yeah, just to go back to, you know, the notes from the meeting in October about a briefing paper on vaping. We were told, and it says the briefing would be available within the next 3 months. So is it not yet available?
I'll follow that up.
Sorry. I can answer to that. So I've seen a copy of that, but I will check with the team with regards to its dissemination. So let me check on that one.
Okay. Anyone for any?
Just waiting to hear.
Seems to me something that perhaps came from the previous council year.
Yeah,
yeah.
You're right.
Yeah, so Jonas is going to chase up that it's in progress just to whether that's ready to be disseminated, but hopefully soon.
And anything else? Keep your hand down.
Stop thinking.
Okay, if there's nothing else, thank you very much. Thank you very much, everybody online. Thank you very much, councillors. I thought that was we got some really good points out there and some really good suggestions from the members for the forward programme, so that was very good. Thank you very much, everyone.